Welcome to The World Today, a program of Perry Worldhouse, the University of Pennsylvania's global affairs think tank. I hope everyone is safe and healthy during this pandemic. My name is Michael Horowitz. I'm the interim director of Perry Worldhouse and a professor of political science. Today's guests are Professors Julie Lynch and Harvey Rubin. Julie Lynch is associate professor of political science at Penn, where her research focuses on the politics of inequalities and social policy in democracies, particularly Western Europe. She's done a vast amount of research on comparative health policy, the politics of health inequality, and the politics of aging. She's the faculty director of the Penn in Washington program and co-director of the Penn Temple European Studies Colloquium. She's also an expert advisor to the European Regional Office of the World Health Organization. Professor Harvey Rubin is the professor of medicine and computer sciences at Penn. His biochemical and genetic research on infectious diseases has been funded by the NIH, NSF, DARPA, all the government agencies, basically, the Global Alliances for TB Discovery, and the Gates Foundation. He served on national and international scientific review panels and has been a member of the U.S. National Science Advisory Board for Biosecurity. You are two incredible scholars and thinkers, and we're very grateful to have you with us today at Perry Worldhouse to share your thoughts about this pandemic and what's going to happen moving forward. And I want to give you both a chance to make some opening remarks before we jump into questions. And Julie, why don't we start with you?
Sure. Thanks so much for inviting me to participate, Mike. It's a pleasure to be here at Perry Worldhouse, even though I'm not at Perry Worldhouse.
Yeah.
So there's a lot that we don't know about what's happening now and that we don't know about what will happen. But one thing that we know for sure is that understanding the relationship between social inequality and health is going to be one of the keys to fighting the pandemic successfully. So COVID-19 has revealed very starkly three things about the political economy of health in rich industrialized democracies that I think we need to keep in mind. So first is that social and economic inequalities are strongly related to health inequalities, including the unequal chance of dying from COVID-19. So the other day on Twitter, somebody asked for a 6-word COVID-19 Twitter story, and the one that I came up with was deadly inequalities have been there all along. So this isn't something new. This is something that we know about how the political economy of health works. The second thing we have to keep in mind is that countries with more social inequality, and this is also true for states and communities, also tend to experience worse health outcomes across the board. So it's not just that poor people do worse when there's a lot of inequality, everyone does worse when there's a lot of inequality. And a third thing to keep in mind is that government action to reduce inequality, things like social and labor market policies that blunt the impact of inequalities that are generated by the market, these kinds of policies are critically needed to create healthy societies. And this is especially true now when policies that allow people to access healthcare and to stay home from work safely, for example, are absolutely crucial to stopping the spread of the virus, but they're also going to be critical for our emergence from the pandemic with functioning economies. So two big questions that I'm thinking about looking at sort of 5 to 10 years out are, looking backwards, how are we going to explain differences in how governments, both domestic governments and, for example, the European Union, how are we going to explain how governments responded to the challenge of reshaping inequality during the COVID-19 crisis? And secondly, how much of an effect did these efforts have on death rates across countries? For the moment, I think we have to be really, really cautious because the data just aren't there. We don't have good data on how many people are dying and who's dying and what they're dying of. So that's going to have to wait, but I think that's going to be a big task for the sort of retrospective view.
Harvey, what's going on in the world? What can we do about it?
Thank you, Michael, for inviting me. Julie, it's great to meet you, even remotely. And I'm glad you mentioned a number of the issues that I will bring up as well. Let me say totally unequivocally, this is a failure of governance. The COVID-19 experience that we're all living through, and I'm living through this clinically, taking care of patients, is a failure of a global governance system. I think I'm going to try and share my screen, but I don't think I can. We have been talking for a long time in my group about how governments can respond to these problems. When I say it's a failure of sharing basic science and drug development. It's a failure of sharing distribution of not only drugs, but medical equipment and medical personnel. It's a failure of knowledge sharing and data collection. And it's a failure of sharing best laboratory practices. We've talked about this. We've talked about this at The Hague. We've talked about this at the UN. We do not have a global governance system. We don't have a system that's based on a judicial forum either. In order to really not only respond to, mitigate, recover, and go forward, I believe we really need a multinational program that addresses all of these issues. And you can see in every one of these issues where the failures occurred. And I don't have to go through that with everybody, because I'm sure you know exactly what I'm talking about. There are global governance systems for the sea, for outer space, for landmines. We don't have one. The World Health Organization does what it can do, but it's not set up to take a responsibility for example, global clinical trials. It doesn't have the responsibility for doing basic science, translating that to drugs and ventilators and the medical equipment we need. It doesn't have the responsibility and the clout for knowledge sharing and data collection that Julie just talked about. Not only that, in terms of inequalities, we do a lot of work in Southeast Asia, and Myanmar, and West Africa. If you think it's bad here, the situation in low and middle income countries is going to be even worse. The notion of social distancing in parts of the developing low and middle income countries is unheard of. There's a resurgence of the disease now in Singapore, where in areas where we have migrant workers working where they live in dormitories. So the issues that Julie raised and the issues that we were seeing emerge on a day-by-day basis has not only a global impact, but going forward, it has an even more serious impact because we're still not ready to respond to the next outbreak. Believe it or not, we have to have more data. We have to move from an area of what's called epistemic uncertainty, where I don't even know what I don't know yet, to aleatory uncertainty, where I can put a probability distribution on the risks. We need to collect the data. We need to distribute it in an equal fashion. And we have to recognize that some countries can't contribute the way other countries can. So this notion of inequality is really important in what countries can do. Countries can provide data. They may not be able to provide capital. So we need a forum that will take us forward in preparation for the next pandemic. And I'll turn it back to you, Michael.
I mean, I would like to, I'll ask you at the end to end on some encouraging notes, but it's a challenge to start with. And so Julie, let me turn to you. You have worked with the World Health Organization's regional office in Europe, and without, look, if you want to dish to us, that would be great. But without revealing any confidences, what have some of those conversations, been like? How has the tone of them especially evolved over the last maybe month or so as the severity of the crisis writ large has become clearer?
Well, I should say that I haven't been on sort of a series of calls over the last few weeks. It's just been one or two, and then more sort of intense bilateral work with other members of the expert advisory group. But I will say, based on my experience of working with the WHO European Regional Office in the past, one of the things that's very challenging for that region is that it includes countries from Iceland to Central Asia. It includes both democracies and non-democracies. It includes countries that have really widely varying levels of infrastructure, both in terms of health services, data collection, and other social policies. And so one of the things that has always been of concern in this region as it thinks about how to deal with health equity issues is how to put together a program that really works for such a wide variety of countries. And I think, what Harvey is saying partly is that once you get to a global scale, it becomes even more challenging. So, but I think, there's a sort of fractal fractal nature to the world, where even if we were to drill down within the United States, we would see that there are parts of the United States that are much better able to cope. For example, my parents live in upstate New York in Tompkins County, and Tompkins County has been doing an amazing job of testing, tracing, and supported isolation, but it's one county that has tremendous resources. It's, you know, people are widely dispersed. It has a major research university in the middle of it, right? So there's such a fundamental inequality, even within countries, in sort of the spatial allocation of resources. I think this is always a challenge for the WHO to address, and it becomes even more of a challenge at a global scale.
So Harvey, maybe you could jump in on the global aspect of this. You know, you've worked on some of these, you know, global infectious disease issues throughout your career. And, you know, for those of us, you know, novices, you know, in some ways that, you know, at home, you know, if you ask me, all right, like, who's going to make it better? I would tell you it's the CDC in the US and the World Health Organization abroad. So, you know, give us your diagnosis in some ways. You know, the World Health Organization's come under a lot of criticism for some of its efforts at a global scale. You know, what's going on, and how does it compare to some of the pandemics of the recent past?
Yeah, so you're right, but up to a point. So the CDC is a tremendous organization. The World Health Organization is a tremendous organization. One or the other may be more or less politicized than the other. That's the case whenever you have a number of participants and stakeholders. Neither one of them, though, are empowered to carry out an integrated system. So just for an example, in my own experience, we're trying to deliver vaccines in very low income countries. How do you ensure a supply chain to get a vaccine to a kid who lives miles away from a central warehouse? So we're doing public-private partnerships in order to put vaccine refrigerators at cell towers called Energize the Chain, where you actually do a public-private partnership. And that works. So we're up and running in Myanmar and Guinea and Ghana and Zimbabwe. But it's one tiny part of the overall supply chain problem. The supply chain in low and middle income countries doesn't fall under the auspices of the World Health Organization, doesn't fall under the auspices of the CDC. Gavi, the Global Alliance Vaccine Initiatives, funded by Gates and by sovereign states and the World Bank, they do as best a job as they can. But they're providing vaccines, they're providing some of the infrastructure, but they're not responsible for the supply chain. How do you actually, who's in charge? Individual organizations do a great job at what they do a great job at. So, but the problem is integration. And there is no global integrating organization. And we've been saying it can't live at the UN, even though that may be a natural place. Quite honestly, it's too politicized. It can't live in the United States or in Great Britain or Germany. It has to live in some larger organization. So my prognosis for the globe is not that promising, because we can't look to that global organization. Starting global organizations is notoriously hard, as Julie said. It is really, really hard. But, you know, we have nuclear arms agreements. We have agreements that have kept the world somewhat safe. We have to be very creative. Maybe it should live at The Hague, and I've been there and talked about this. Maybe it should live somewhere else. Maybe it should live in Kenya. Wherever it lives, it has to be able to participate in a global way. And I think what COVID is really showing us is not only is the poor person living in America at risk, whole global economies are at risk. And until we recognize that and put the money and resources that we put into ballistic missiles and battleships and insurance companies and everything else in the world, we're going to have another pandemic. And guess what? The next one could be even worse than this is, as bad as this is.
Can I jump in, Mike?
Please do. I have a question for you, but yeah, absolutely. Please jump in.
So this is just, you know, directly following on what Harvey said. You know, we have an integration problem, and Harvey's focused on kind of what's happening. Ooh, I'm losing fingers. What is happening kind of at the global level that can help to integrate all of the various kind of isolated actors that need to be integrated to deliver a full supply chain of response, whatever that response consists of, whether it's vaccines or social policies or whatever. But there's also got to be something meeting that, you know, something coming from the bottom up to meet it. And that's where politics is absolutely critical, right? Individual countries are by and large responsible for making that meet in the middle. And when really rich, powerful countries simply are not politically able to meet, you know, to be appropriate partners for any kind of development of an integrated solution to this problem, it's really hard to expect that countries with less capacity and that are even more politically fragmented are going to be able to do that. So I share Harvey's, you know, verging on despair. But I think that there are two ways to act on that. And one is to reinforce what's going on at the global level, but the other is to try to reinforce what's going on locally to make countries and communities and firms better able to kind of meet the global opportunity in the middle.
So, well, let me follow up and ask a question there about, in some ways, about comparative health inequality. You know, if we're gonna try to predict and, you know, maybe who comes out, I would say better in this from a societal perspective, will it be countries that started sort of ex ante with less health inequality, or, you know, as opposed to those where you have more sort of disparate gaps in access? I mean, what can we sort of learn from that to try to, you know, I understand we can't, you know, look back yet, but, you know,
Right.
What do you think your research would suggest about how that existing inequality will affect national response?
Well, what I would say is that countries that have been good at dealing with social inequality in the past are very likely to be those countries that are going to deal better with this as well. So if you think about what has really been missing in the US response, an adequate replacement for wages. Running this through the unemployment insurance system is not working. And that is entirely predictable given what we know about the US unemployment insurance system. We knew that that wasn't going to work. And what was really needed was a much more comprehensive system of wage replacement, employment guarantees, et cetera. Now, many countries in Europe already do that. And they've been doing that for 20, 30 years, and that's part of why their populations are healthier to begin with. So unemployment insurance is just one example. You know, we don't have sick leave policies in the US by and large, so obviously people are going to go to work when they're sick, and that's going to spread disease more quickly. So if we just look at a very basic level at what are the parts of the world, what are the countries, what are the states that have functioning social safety nets that allow people to live and to behave in reasonable ways? Those are the places that are going to deal more effectively with this. And we're already sort of starting to see that. But it's hard to see because, again, we don't have the data. And the data aren't collected in a consistent manner. So for example, right now, it looks like Belgium is doing really badly. Well, the reason it looks that way is because Belgium is counting a lot of deaths that are occurring at homes and in care facilities that other European countries aren't counting. So,
interesting.
You know, and Belgian death certificates have always looked different from French death certificates and Dutch death certificates, right? So very basic facts about how we understand the world around us, how we understand the health of populations, are really, even within the European Union, quite unstandardized. And so it's going to be a long time before we're really able to be sure about this stuff.
So here's a follow-up question for why don't we start with Harvey, I think. And this is I mean, we've got questions flying in from the audience, so I want to sort of shift to there. And that there's been we've had this emphasis on testing and tracing, you know, given some of the challenges in implementing that, even in the richest countries, you know, even in Western Europe, you know, even in the United States, to a point that, you know, sort of Harvey, I think you made at the outset about the sort of rest of the world. what's the alternative? If sort of test and trace is harder, say, in parts of West Africa, parts of South America, say, is there another path?
The only path, as Julie said, is collecting the data. And as hard as it is here, imagine what would happen in a refugee camp somewhere in the Middle East. Imagine what would happen in a domestic dormitory in Southeast Asia. You will never be able to, under the current system and the current funding and the current organization, do the testing. I mean, everybody you listen to, from Tony Fauci to everybody, it's all about getting the data. It's all about understanding how far spread this particular pandemic is. It's obviously spread by respiratory droplets, whether they're aerosol or not. Imagine if this really became entrenched in some of those other areas in the world. Can't do it in New York City. You can't do it in Philadelphia. You're not going to do it in a refugee dormitory, that's for sure. And so I'm really worried. I am really worried. We talk about second waves and third waves. I think there's no question that that's going to happen. And it's all because we don't know how to really globalize the testing. And then we certainly don't know how to globalize the mitigation.
Yeah, the alternative to effective testing and tracing at this point is a lot of deaths. That's kind of where we are.
Unfortunately, Julia is exactly right. That's
cheery. So here's another question that maybe we can get a little more optimism on from the Q&A, which is, given how difficult it is to, this sort of gets us back to the politics of it and the, shifting back from the national level to the international level. So let's maybe put aside the hopes and dreams of a new global organization for a minute. Is it possible that regional organizations, whether the EU or the OAS or sort of others, could essentially beef up in the way that they handle healthcare challenges to help us both address, solving this pandemic and then potentially moving forward? Essentially, can regional organizations fill in for the global governance, for the obvious challenges we face from a global governance perspective?
I can start with the EU since you mentioned it. Can the EU? Yes. Will the EU? We don't know. So the EU is going to meet on Thursday, and they're going to decide what to do. And a huge part of that decision is going to be about whether they can overcome, actually, Kate McNamara and Matthias Matthijs had a nice piece in the Monkey Cage this morning where they talk about the sort of saints versus sinners dynamic that's been going on in Europe since the global financial crisis. Will the EU be able to overcome the suspicion on the part of the thrifty Northern European Teutonic peoples that the, lazy and improvident Southern people within the European Union are just going to waste the money if they issue Corona bonds, right? I mean, this is the level of discourse that is occurring. And it is honestly, I mean, it feels like children. I am a mother of 2 children, and it feels like children arguing when there's something very, very big at stake. So will the EU be able to overcome this? Maybe. I hope so. Will other regional organizations be able to get their act together in a better way? Maybe, I don't know. But I'm a little worried.
Let me jump off on that one as well. Michael, so you asked about the data and can local organizations do it?
There's another those interested, by the way, I just pasted into the chat the link to the Monkey Cage post that Julie mentioned. Sorry, Harvey.
No, I learned a word, monkey cage. So there's another component here is that first of all, let me say, I don't think local organizations can do it. We've not been able to do it in the United States. So there's got to be another whole set of incentives and funding for them to be able to do it, whatever that it is. But when you talk about data, what's more important than data is actionable data. I can collect all the data in the world. If I can't act on it, it's of no use. And so when we say we need to collect the data, yes, we need to collect the data, absolutely. But then what are we going to do with that data? How do we act on that data? The only valuable data is data that we know how to implement the solutions that those data start telling you should be there. And we don't even yet have really adequate mathematical models. There's 100 mathematical models out there, and complete transparency, we're working on some with my engineering colleagues. We don't know yet how to, quote unquote, act on that data. That's what's important. And so when you say, let's get the local organizations to do it, if they can, if they can do it, which they may or may not be able to do it, what are we going to do with that data? Who's going to organize that? Who's going to take ownership of that data? That's really the issue.
So let me ask a follow-up that gets into the data question and gets into the and that's about some countries in Asia. And so maybe Harvey can start answering this. And that's we've been hearing about countries like South Korea and how well they've done in addressing the challenge. But then you mentioned Singapore. Or I think Julie actually I don't remember who mentioned Singapore, but Singapore seems to have now new regrowth of cases, whereas Vietnam, right next door, seems to be doing pretty well. What do you think we can learn from the experiences that countries have done well? And let me, I know we haven't talked much about the United States yet, but you're making it about the United States. Are there things that can translate into the American environment that could help the U.S. with its response?
So many of the countries in Southeast Asia had the experience of SARS-CoV-1. And so they were, in some sense, prepared. There was an infrastructure in place for tracking and tracing and contact tracing. We don't have that in place. We weren't hit, fortunately, as with SARS-CoV-1 as other countries were. It was a different disease. But what we can learn is how important it is to act on the data. First collect it and then act on it, which means if you're positive, find out everybody that you were in contact with, trace those contacts, and start educating the public about what it means to mitigate. And there's a difference between mandating mitigating circumstances and suggesting mitigating circumstances. And I will leave it up to my two political science colleagues to figure out how to do that. With the notion of actually enforceable mitigation procedures versus suggested mitigation procedures. But it has to be based on tracking and tracing. And if you don't have that infrastructure in place, it's not going to happen. That's what we can learn from Southeast Asia.
Julie, I know that your expertise is more in Europe, but do you want to add on to that?
Well, I mean, again, I would sort of reiterate that I think it's a little too early to know who's doing well and who's doing poorly. But I will say that if you look at a country like New Zealand, for example, New Zealand is probably the country that sort of, in terms of socioeconomic development, et cetera, is most similar to the US that's really done well. Obviously, New Zealand is a country of 5 million people. It's an island. So there are lots of things that make the New Zealand situation very different from the US, but I think there are a couple of things that we can learn. One is that just in terms of the basic infrastructure that was available to the New Zealand government as they began trying to track and trace, they have universal record keeping. They have people's addresses and phone numbers in a unified national health system database. And that was something that, even though they were a little slow to get off the ground, that was critical. They couldn't have done what they did without it. The government was willing to hire on more people when it became clear that they didn't have enough people out in the field doing testing and tracing. Mm. And they were also willing to impose a top-down national level solution when it became clear that regionalized and localized solutions weren't talking to each other and they weren't getting an effective response. So all three of those things, sort of the basic infrastructural competence, the willingness to impose top-down solutions, and the willingness to spend money and hire people as needed are three things that I think, we need to start being willing to think about in the US. There was another a fourth really critical ingredient in New Zealand that I think is a little harder to imagine in the US. And that was a real sense that they were in it together, that the national level leadership was speaking clearly, was not condescending, was conveying a message, this is what's happening, this is what we need to do, from very early on in the crisis. So, you know, national leadership matters too, and that's something that's a little scarcer in the US right now.
So here's a follow-up that actually gets to, we have a question in the queue, comes from somebody who says that they're European and asks about, and you know, maybe Julie, you can start here, given your expertise, that asks about intra-EU tension and essentially the sort of Germany as the big player with sort of economic leadership, the Netherlands, and you know, are there challenges in, you know, obviously this is an economic challenge in some ways as well as a public health challenge, and what does that mean for the way that the EU might work together or not, given that disparities between EU countries are significant as well?
Yeah, so I mean, this goes back to my sort of facetious comment earlier about the squabbling children. I mean, I think at this stage, these divisions and conflicts within the European Union are very real, and they are shaping policy at the European level. The southern countries are the countries that have been harder hit by the virus. Initially having nothing to do with anything that they could have done differently, but already several weeks into this, there are stories that are developing about how poorly these governments handled it, and how naturally, if we were in Germany or the Netherlands, we would have done it much better. So these kinds of tensions are absolutely there and are absolutely guiding the response. What I would say is that there's new research out that suggests from the Max Planck Institute in Cologne, there is some sort of encouraging survey data that shows that survey respondents, at least in Germany, when they understand what's at stake, are really able to become much more favorable than they were prior to that. Towards the issuance of Corona bonds, for example. So I think that, politicians very often in Northern Europe say, well, we can't do anything because our population, our people are opposed to sending money to Southern Europe. But actually there is some data to suggest that the population is able to be educated and has preferences that are more malleable. And so if leaders would lead, their publics might follow.
Let me make a comment. There are 167 odd countries that have signed on to the UN Convention on the Law of the Sea. There are 80 odd, 90 odd countries that have signed on to the Fish Stock Agreement. There are many, many ways that countries learn to get along together. And certainly Julia's right, there's, kids squabbling. But in fact, there may be models. And so I think, not for me to do, because I'm not an expert in this, but I think the academic community and others interested in this might look and do an analysis of what are the commonalities. Where do countries and sovereign states, where are they able to get together and see their own incentives to join in these kinds of agreements? It can't be that 167 countries all of a sudden think, wow, that's great, let's have a law of the sea. Or 87 countries say, let's understand fish stocks. There must be some fundamental approach that the academic, the scholars can really dig deep and get 2 or 3 or 4 fundamental principles that would allow a global agreement. Because there are examples. And I think, even though I started off being very, very, down and all that, and I think on a more positive note, the world has learned to get along to a large extent. And I think the academic community has a responsibility to help figure out what were those commonalities, what were the incentives, what were the benefits, and what were the costs to these countries that people were willing to actually develop such agreements. And I think if we could come up with 5 or 10 commonalities with the right incentives and the cost benefit rate, then I think we could get something done.
I just posted in the comments a link to an APSA is the American Political Science Association. So the report of a task force in 2013 on negotiating agreement in politics. And I was a member of that task force at the time. And I thought, well, this is kind of weird. Like, why are we doing this? Jane Mansbridge, who was the president of the association at the time, said, you know, there are all these really intractable problems. But some societies just seem to be better able at dealing with them and kind of getting to yes, essentially. And so she called together this task force to review what we knew from political science about how to get to those agreements when it was really tricky. And I have found myself thinking more and more about my experiences on that task force and about the report that we produced in the last 6 weeks than I've ever thought about it in the intervening however many years it's been since we did that report. So, I think there are things that we can do. There are, institutional designs that we can try to leverage that will help lead to agreement.
Well, funny, it's a great lead into the question I wanted to ask next, actually. And so why don't we start with Harvey, which is that, some have wondered whether this is the time to deepen global interconnectedness in some ways, rather than the time to build walls, reinforce national sovereignty, et cetera. Do you see any appetite for that in some of the conversations that you're having and some of the people that you're working with, and are there ways that the expert community might be able to build some of those bridges, even if we have political disagreement?
I think that's a great point. Absolutely. The one thing, I lived through the early days of the HIV response, and it was remarkable how many scientists got together and collaborated around the world. This outbreak, this pandemic, it actually dwarfs even that. The amount of expertise that have been shared and the international scientific community that's come together to work on these problems from the scientific and medical point of view is astonishing. I mean, it really does make me proud of my profession. And I can't wait to read Julia's report to see how we could build on that. And if it has to be from the ground up in this case, that's what it has to be. I've been really encouraged by international cooperation at the so-called expert level. It's been really remarkable. Unfortunately, I'm also old enough to know that you do need political leadership. And we're lacking in that now. We need political cooperation across the globe, and it can be informed, and it should be informed by the scientists and the academic community. And it's our responsibility to push that.
Mike, you're muted.
I was going to say, Julie, yeah. Do you want to jump in?
I didn't want to respond to that, but I couldn't hear what you were saying. So.
Oh, I was just going to ask if you wanted to jump in. The next question that we have comes from asks about actually we have an ask for you, Julie. Maybe if there's an article or two on New Zealand that you could toss in the chat, I think people would appreciate it. And why don't we briefly, I mean, I know that this is not exactly what we're here to talk about, but it's hard to have this conversation without getting to the United States. The keeping in mind the limitations of our ability to sort of speak to some of these issues, how are we doing, do you think, in the United States, and what do you think the path forward might be, given the I mean, Harvey, maybe you could speak a little bit to some of your direct experiences, and sort of Julie, as a federal system set up a little differently than a lot of our European allies and partners. What has that meant for our response, and what do you think that will mean for our response?
You want me to start, Michael?
Sure.
Well, let me take it at the most local level. My colleagues in my hospital, I have, we have great colleagues. I have never seen such a level of having each other's backs. There's not been a single instance where one of my colleagues says, I can't cover this service, or actually asking, let me do this. Talk about running into burning buildings. the people who work in our, and I'm sure I've talked to friends in New York, I've talked to friends in California, and it's the same everywhere. The local response by the healthcare workers, by the first responders, by EMT people is absolutely amazing. The human nature is really to help for the most part. I mean, there are a couple of, criminally insane people, but the human nature is really to help. And I've seen that over and over and over again locally. So I think there is hope there. Can that be generalized to a more implementable procedure? Not when you read about how state X is bidding against state Y and sending trucks in disguised trucks to pick up things across the border. That really says there's a real breakdown between people trying to take care of others and people trying to take care of themselves and their reputation. So there is a big disconnect between the two, and somehow we got to figure out how to translate the nurse who offers to work 3 shifts in a row to governors and presidents.
Julie?
Mike, can you repeat the question? I was busy posting about New Zealand.
Oh, sure.
When you asked it.
I was gonna, the thing I was kind of curious about was and Harvey sort of got to a bit of it, the federal structure in the United States and the way that, we've seen that sort of play out. I mean, some of that, obviously, I think the question is how much of that is the president and how much of that are in some ways structural things built into how, the founders designed our government, and in a way that decentralizes power more than in some European countries. And, what do you think that means for the American response to coronavirus? And more generally, how do you think we're doing?
Well, I don't think we're doing very well. I can elaborate, but wow. When it comes to the federal level response, it's been really bad. As Harvey said, there are lots and lots of bright spots at the local, state level and at the level of just people doing what needs to be done. But in terms of national level leadership and policy, it's been absolutely, I think, atrocious is not too strong a word. The American federal system definitely makes a response to stuff like this more complicated. There's no question about that. I think it's important for us to look to other models and see if there's stuff that we can learn about how to manage crises like this in a federal system. Australia's federal system is a little bit different from ours, but one of the things that's been noteworthy about their response is that they very early convened a national, a federal level structure that brought people from the different state governments together to make coordinated policy decisions that could work for the whole country. And the US has done that in the past in disaster responses as well, bringing governors together, having high-level task forces, for example, that are really responsible for leading the federal level response and for integrating that response across states. And unfortunately, it just hasn't happened this time around. So there are models that we could use. We're not using them right now. And even the things that we're not doing effectively. For example, Vice President Pence, is meant to be sort of the COVID-19 czar, right? But he's clearly not been given the responsibility to make final decisions that will stick with regard to how this crisis ought to be handled. So nobody knows where the buck stops. And I think that's been really problematic.
And there's another aspect too, just to bring it back. It can't be just a federal response. It has to be a local response, but it also has to be, again, a global response. Why? Because we're running out of medicines that we use for people who don't have COVID. The raw materials may come from China. The raw materials may come from South Africa. And so there can never be just a federal response. There's got to be, of course, a local response, but there has to be a global response too. So, the raw materials for many of our devices, for our drugs, for everything, isn't found in the outskirts of Philadelphia. They're found in the outskirts of somewhere else. So we need to be able to integrate if we're going to have a robust federal response, we need to have a robust global response.
Yeah. I mean, the shortage of reagents for the tests is like a critical example here. Yeah.
So, I mean, I realize this isn't either of your particular expertise, so there's a question in the chat asking about supply chain issues. And, you know, what we might be able to, you know, is there anything that either of you are, you know, are thinking about the, you know, how we can alleviate those, particularly as we think about, you know, like, again, it gets back to something, you know, from the beginning, like if we're having trouble with reagents in the United States, what does that mean for the rest of the world?
I can tell you, it's a disaster waiting to happen. I hate to be a downer again, but, you know, I know for a fact we've been tracking this in a couple of countries that we work in. And the supply chain for low and middle income countries, as bad as it is here, it is almost infinitely worse in those countries. Not only the fact that the actual vehicles need to be there, the ability to track and trace real-time inventory isn't there, the infrastructure of roads and airline isn't there. And so the supply chain is maybe, in addition to knowing where the raw materials are, having a database, having the ability to know where excess is or deficiencies are, sharing knowledge, getting that data, acting on it, being physically able to implement a solution, once you have all of that, is still an overwhelming problem. I mean, we talk about a vaccine in this country, and we can talk a lot about how that may roll out. Can you imagine delivering 300 million vaccines, even in this country, in a short period of time? That's this country.
Yeah.
Right.
I think also, you know, supply chain issues aren't limited to the things that we need to fight this particular disease, right? So in the US, obviously, you know, one of the things that's been really salient has been the shortage of PPE, of just sort of basic commodities that get used in healthcare settings that are needed to keep healthcare workers safe. And I just posted a link to a podcast that was done by the Trade-Off folks in early February, or I guess mid-February, where they actually looked at the supply chains for a number of sort of very basic medical commodities in the US, things like masks, sterile gowns, saline solution for IVs. And one of the things that they discovered is that there's been huge market concentration for these basic commodity supplies that are used in American medicine. There's been sort of offshoring of production to low margin goods like saline to Puerto Rico, right? So to the parts of the US that are most vulnerable to natural disasters, for example. So as we have sort of cut all of the slack out of the supply chain in supplying hospitals, over the last 10 to 15 years, you are starting to see more and more supply chain problems. And the fact that the Trade-Offs podcast was talking about this really before COVID hit, I think is just indicative of how widespread the supply chain issues are. And a lot of that has to do with the fact that at a regulatory level, we just haven't prioritized having systems that have a little bit of slack in them.
Let me just say, first of all, I'm really impressed how Julia can multitask, talk and post. That's incredible.
It's very impressive.
That's very impressive. There have been a number of studies where the notion of outsourcing supply chain from the Ministry of Health to the private sector has been fairly impressive. And so Gavi has written a white paper on outsourcing the vaccine supply chain away from the Ministry of Health. It's been studied in South Africa and in Ghana. So I think the idea of using public-private partnerships to get to some of these issues and using some social impact investment bonds to fund that, where the outcomes, the metrics can be clearly delineated, using that sort of structure of public-private partnerships with social impact bonds, with the defined metrics, may be the beginnings of a solution.
So I bet you were not expecting me to say what I'm about to say next, but yesterday we had former National Security Advisor H.R. McMaster on to talk about COVID and geopolitics, and he made a very similar point about public-private partnerships and their importance in moving forward, particularly in an American context.
He's right.
Now I want to switch from the United States back to Europe. And in particular, maybe we could start with Julie. Sweden is a country that's gotten a lot of attention for what sort of looked like a very unorthodox approach relative to many other countries, and not sort of shutting everything down, but then sort of some of that is reversed. And so, what's going on in Sweden? And is that is this what not to do, or is there a role model here?
Well, so the most recent data that I've seen, probably almost a week old now. So, things are moving so fast that sort of feels like an eternity. The most recent data that I saw was that that infections and deaths were starting to rise in Sweden, and so increasing regulation and sort of increasingly stringent stay-at-home orders were being issued. I mean, so the sort of Swedish exceptionalism within the Nordic states was, up until a week or so ago, that Sweden had sort of declined to impose stay-at-home orders, and had instead appealed, the Swedish government had appealed to the population to do the right thing, to be safe, to social distance as possible, but to not shut the economy down, keep the schools open, keep the cafes open, keep some semblance of normal life. And the government came in for a lot of criticism for that decision. Why are you doing this? And the Swedish government's response was, look, we trust our people. Our MO is not to tell people what to do and to send police around to make sure that everybody's doing what they're supposed to do. Our MO is to, trust in each other as a society to do the right thing. And unfortunately, that just doesn't seem to have been enough in this case.
Any thoughts on Sweden, Harvey?
I agree with Julia. It's not going to be sustainable. That the original "let them do what they want to do" is not a sustainable response in this environment.
So, to what extent we've seen the moving from maybe from Sweden to Germany and comparing it with the U.S. There's a little strain of thought on the internet suggesting maybe one reason why European countries like Germany are doing well is that they have leaders who are scientists. As opposed to, and
Sorry,
this
they
is
have
not
leaders
just
that are what?
That are scientists. And this is not just a poke at Trump, because this was, certainly, that's not, with the exception, I think, of maybe Herbert Hoover, this is not the, it's not been the traditional background of American presidents. Is there something to the idea that having more leaders that themselves have more scientific experience, that's helpful?
I'm not sure that having leaders who are scientists themselves is necessary. I think it can be helpful. But what I do think is necessary, and which is not as much the case here as it is in many European countries, is to have a pretty free and unencumbered flow of both ideas and people in between academia and government research. So European countries tend to invest a lot more in sort of government-sponsored research. There are a lot more people who are both college professors and they work in a government-sponsored research lab, for example. And so in my experience, working with public health and epidemiologists and health economists in Europe, there's just a much freer flow back and forth, and that leads to a freer flow of information, of personal relationships, of trust. And so I think that, one of the issues that we have in the US is really, the only scientists who really have much influence at the federal policy making level are economists. And this is not a knock on economists, but there are lots of other scientists who have other kinds of approaches and information. And I think the US government is sort of uniquely impermeable to that kind of information, uniquely resistant to taking on board scientific information. And that's only worsened in the last 10 years or so as we've seen sort of the rise of an anti-elite, anti-intellectual kind of trend within the US.
Yeah, I think it's a disaster. I mean, you look at the kinds of people that Kennedy had around him and advising him in science, presidents of MIT and presidents of Harvard. Look at the kinds of folks that FDR put in place to advise him on scientific issues during the war. Not having unbiased and speaking, truth to power, and being able to listen and understand the nuances of, so you don't have to be a scientist, but you got to be able to listen to the scientists, listen to the experts, have an open mind, and actually be curious about what's out there, and understand what science is all about. And it's not only this, it's climate change, it's everything in every scientific issue, EPA issues. You can go down the line with certain presidents, and this one in particular, about how science has been second, third, fourth class citizens. It's recipe for disaster, absolutely. And a lot of my friends and who have served on national scientific boards, and I was on NSABB, I've asked them, quite frankly, would you go work for this president? And unfortunately, the answer is no. Not because I have a political issue with it, but they just don't believe that their advice will be listened to openly. I mean, I have the most amazing, if you ask me who an American hero is today, it's going to be Tony Fauci. That man is incredible. He not only is a great, he's a great basic scientist. He's a great clinician. He's a great policy person. Guys like that, you got to multiply him by 20 and put him in places of responsibility, and he has to be listened to.
So we've just got a couple minutes left. So we've got two more questions. One, asking you to predict the future, and then the second, asking you to tell us something good. So let's start with quickly with predicting the future. This question somebody asked in the Q&A. How do you see this ending, and when do you see it ending?
Julia's going to go first.
Yeah. I swore off making predictions after Trump won the presidency. But I see this ending with a whimper, not with a bang, after many waves. And, 3 years. I'm not a scientist, so that's based purely on sort of my perception about what's needed at a policy level and how likely that is to happen, to prevent us from really diving into a second wave and a third wave and a fourth wave of this.
I agree. I think it's gonna end with a whimper. It's not gonna go away by a miracle. It'll start going away when policymakers and scientists and influencers realize we've got to put money and brain power into the solution going forward. And the good thing that's going to happen, the positive note, is that I think even though it's going to be an interesting comparison of social distancing and emotional contracting. So I think even though we're socially more distant, and I've seen it in my own family, I've seen it in my colleagues, I've seen it across the country, somehow emotionally we're closer. So we may be physically more distant, but emotionally we're closer. And if I had to think of anything that's positive that's coming out of this, it's that emotional closeness.
So for the last question, let me ask you to.
Wait, do I get my positive thing?
You can. Sure. Yes, please.
I think we finally realized how broken the system in the U.S. is. And there may be, a push to fix it.
All right. So if you're both wrong and things turn out much better than we think they're going to, why do you think you will have been wrong? If you look back and you say, wow, I thought this was going to end like a lot worse, but, really it turned out pretty okay. I mean, like relative to being horrible, but, why would you have been wrong?
Can I not accept?
Want to go first?
Can I not accept your premise? It is already horrible. It is already horrible. When you read in the local newspaper that they're putting body bags into the back of open pickup trucks, it isn't going to end better than we think it is. So I would say unequivocally, Julie and I won't be wrong.
I would say that it's already so much worse than most people realize. So that's to go along with what Harvey said. But I will say that there is still a lot that we don't know, including about the biology of the disease. So it is possible that there are, going to be things that we learn about how the disease spreads, how difficult or easy it is to come up with a vaccine. I mean, maybe there's going to be some scientific answer to this problem. But I think if we think about what we know about how human societies respond typically in crises like these, it's not a super cheerful scenario.
Well, at least, to your point, we'll be spending more time with our families and we'll be more understanding of our colleagues. With that, I hope everyone will join me in thanking Julie and Harvey for a fascinating conversation. I mean, having this kind of expertise at the University of Pennsylvania is extraordinary, and we're really grateful to everybody for tuning in during this time. Even though I guess everybody is maybe home a little bit more than usual. And I hope that everybody will tune in next week at the same bat time, same bat channel, 12 p.m. on a Tuesday for a conversation on the history of pandemics. Hope to see you all then. I hope everybody stays healthy and safe, and have a great day.
Thanks, Mike.
Thank you.